Hello and Assalamu alaikum.
Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right and the upper left maxillary regions with the lower left maxillary region. Now, if you look at the posterior teeth, the patient is missing posterior teeth, and the doctor has asked for evaluation for implants. On the transaxial view, we can very clearly show you that the implants, the bone for the implants is not very sufficient. This is um, the one, two, three, and the four first premolar region, and we will now show you. There we go. So this is the first premolar region. We've got 4 mm of ridge width with approximately 4.4 mm, 4.9 mm of ridge width at the crest, 4.4 mm of ridge width at the middle, and approximately 10 mm of ridge height. So this can house a very thin implant, 3.3 for a premolar. But as we are moving further posteriorly in the region of the 5, we've got again very significantly thin ridge. We've got just 4 millimeters of ridge width with approximately 9 millimeters of ridge height. When we go further back towards the molar region, we've got absolutely no bone left. So we have just 1 mm of ridge width with approximately 5.3 mm of ridge height and very little bone for a sinus lift procedure as well. So the molar region cannot sustain an implant procedure. On the upper right hand side, the upper left hand side, we can show you that again the ridge is so significantly thin that a implant procedure cannot be performed even with sinus lifting procedures. It is going to be significantly difficult, and because the sinus on the left hand side is filled with sinusitis quite intensely. So if we show you the axial view, on the axial view, you can see that the right sinus has little mucus, whereas the left sinus is completely filled with mucus from the bottom to the top. So this is the sinus on the right, this is the sinus on the left. So the sinus lift procedure is also going to be significantly hard in the upper left quadrant. Now, when we look at the teeth in the front, we're going to take you quickly through all the incisors and the canines. So this is the incisor in the front. Good bone support, periapical radiolucency, has a cavity. This is the lateral incisor, periapical radiolucency, does not show any significant cavities. This is the canine. The canine is doing well. No significant cavities, whereas the first premolar also has bone loss and has taurodontism, which we can see very clearly here on this image. And we've got a little bit of a dilaceration and a dwarfed root in the upper left, upper right, second, first premolar. There we go. So this is where you can see taurodontism, and you can also see calculus formation here, and you can see a little bit of a longer root and a dilacerated root in the upper right, second, first premolar. When we move to the upper left, lateral incisor again significantly cavitated with periapical delucency. The upper left canine also is not doing so well. Periapical delucency with significant bone loss, and immediate or delayed implant is not possible in the canine region due to the significant bone loss that we see. The central incisor here has a periapical delucency as well, and significantly it is grossly carious. Again, a immediate implant is going to be difficult due to the angulation of the ridge.